Well, it is time to get your pet questions answered.
UW veterinarian Sandra Sawchuk is here. We're taking your calls at 270-9933. Nice to see you.
Nice to be back.
Let's get right to the phones.
Yeah, we got lots of calls here.
They are jammed today.
All right.
Let's go to Kathy in Middleton. Hi, Kathy. What's your question?
Hi, Sandy. I'm wondering at how many weeks old can you tell the kitten's age, or excuse me, the kitten's sex?
At
and
birth.
Also
At birth.
At birth, yes. It's very actually quite easy to determine the sex very, very early. And what I would suggest is maybe, consider going online and looking at kind of cat anatomy. There's a difference between the female to the male rectal to urethra opening, and they're shaped a little bit differently. So it's actually very easy to sex cats, but you know what? People get it wrong all the time. We do a lot of instant sex changes where the cat comes in as a female and it turns out to be a boy and vice versa. So yeah,
That's confusing for the kittens.
it is. Yeah.
Mallory in Wanakee, you're next. Hi there. What's your question?
Hi, I have a dog, a Springer Spaniel, that she loves just to chew on rocks and play with them. Is that normal?
Ooh.
No, I mean, it can't. Some dogs like to pick things up and carry them in their mouth, and your dog has developed a habit with rocks, and boy, what that's going to do is break teeth and wear teeth down very, very quickly. We also see dogs getting them impacted in their intestinal tract, in their stomach, and requiring surgery. I would strongly recommend that when you're outside in the backyard with the dog, that you have a ball or something there that you can throw to keep your dog occupied so that the rocks are not something that she wants to put in her mouth. And it may mean even changing your landscaping if it's that dangerous for your dog.
So it's that bad.
I've had some dogs where we've had to actually put a basket muzzle on them when they go outside so that they can pant and drink water, but they can't put any solids in their mouth because it's so dangerous. Yeah.
All right, Judy from Madison. You're next. Hi, Judy.
Hi. I have a aging dog. He just turned 16 in January, and he has deteriorated eyesight, very little hearing, and his legs are not strong. And I'm just wondering how you can tell an aging dog like his quality of life and when you make decisions.
I can tell you that 3 out of 4 people in a study that was done are always wondering, did I do it too soon? Did I do it too late? There's always that worry. And my pat answer for most owners is you'll know. You know your dog better than anyone. And, age isn't a disease. And yes, hearing loss and vision loss is going to be occurring as they get older, but you can make adjustments to your home that are going to give your dog still good quality of life. And so I think you need to be looking at things like, is your dog in pain? Are they still able to urinate and defecate outside? What's their appetite like? Are they still mentally alert where you come over and interact with them and they want to be social? If your dog isn't happy, isn't doing the things that your dog loves to do, then it may be time to be considering ending their life. They rarely do dogs and cats die naturally. It's often one of those things where we have to give them that gift of not having to go through pain.
Oh, it's the toughest decision.
And and I live by the motto is I would rather end a pet's life a week too early than let them suffer one day too long. Mm-hmm. And that is what I live with. And my own dogs are both getting elderly, and Vanna is over 10 now, and I know that the day that I say, do you want to go for a car ride? And she just sits and looks at me and doesn't get excited, is the day that she probably isn't happy about life anymore.
And you can tell.
You can, yeah.
All right,
I'm going to start crying.
I know. I am too. We're going to take a quick break. Let's recover here. Yeah. We'll take more questions. Stay with us. We're answering more of your pet questions next.
And
Sandra Sawchuk is taking your pet questions, and we're going to start this segment with Tina from Sun Prairie. Hi, Tina. Go ahead.
Hi, I'm calling. We got a 10-week-old golden retriever, and she just,
She's chewing on everything.
Yeah. Well, when you have a puppy, one of the things you have to do is definitely dog-proof your house. And so that means no shoes are left out, nothing is left out for your dog to be able to chew on. And you always have to have something in your pocket so you can redirect the dog to the appropriate thing. So instead of chewing on the corner of the coffee table, you can make a noise just like, get away from there. Here, chew on this. And you just keep redirecting. And eventually, the puppy is going to figure out what is appropriate to chew on. But things that you don't want to introduce to the dog are anything that's hard enough to break teeth. teeth, which would be nylabones, the real hard, non-flexible ones. They do have a puppy version that are flexible. The natural bones can break teeth as well, but the flip chips and softer toys, those are all great things for your dog to be able to chew on.
What about
Joys of
rawhides?
puppyhood.
I know, and it's like 100% of your attention's on the dog all the time.
Don't you have to be careful of rawhides because they're high in calories?
They are very high in calories if the dog gets addicted to them, and because they're made from animals, there is that issue with Salmonella and E. coli. And so if you've got someone that's immunocompromised or a young child in the house that's going to be picking them up, you want to be careful with using them.
Yeah.
And you need to be able to have them sized appropriately so you can, get them away from the dog before they get small enough that they can swallow a big
Right.
chunk.
They get all mushy.
Right.
Yep.
All right, Diane in Albany, you're next. Hi there. What's your question?
Hi, we have a 10-year-old pug that was diagnosed with a grade 3 mast cell tumor. Wondering what your protocol would be on a dog if it was your dog with that cancer.
Well, first of all, I'm glad that you have had this cancer staged. It's one of the more common types of cancer that dogs can get. What mast cells are the cells that when you get stung by a bee, your tissues swell up and you get that swelling. That's because mast cells have these granules in them that release histamines and all these other ingredients that cause the swelling of tissue. And so they are very invasive. And a grade 3 is one of those ones that you want to be fairly aggressive with. The low grade ones are often surgically. You do wide surgical margins. Usually if even the mass is this big, you're going to take that much tissue off. And so it's often we do surgery to start with, debulk it as much as we can, and then you're looking at chemotherapy. And we have a wonderful oncology department at the veterinary school that does all kinds of new protocols and is always working with different research things that help a lot of patients with cancer, and they can have great quality of life and live for a long time. So even radiation therapy, we have a tomotherapy unit at the vet school now.
Really?
So yeah,
that's
There's a financial aspect of that. though.
there is, but I wouldn't, at this point I'd say, wide surgical margins, have it staged, which sounds like it is, and then, be looking at what other ancillary treatment can we use.
All right.
And I would not think twice about putting my dog through chemotherapy. I think
that's good to hear.
we do it, and we're not doing it to the point where they're losing hair and sick. We want to have them have good quality of life.
And this changes all the time.
It does, yeah. What's available, and I think the drug that they're using mainly for mast cell tumors now is one called Palladia. Yeah.
Pretty amazing stuff.
There it is. Yeah.
All right, we are just about out of time. We don't have time for another call.
Yeah,
Heartworms, now's the time.
Oh yes, get your dog on heartworm preventative, and ticks are out in full force.
Yeah.
And so we got to get that stuff on them. If you haven't done it, get that on your dog, either one of the new collars like the Seresto collar or one of the Spot On products.
All right.
All right, thanks, Sandy.
You're welcome.
Thanks for your calls, everybody. We appreciate it.
Yep.